Hello and welcome to Medbay in 5 minutes. Today we will learn about your medical toolset, the health system, common medicine, cloning, and surgery. To start, in your toolkit are 2 auto menders, your Pro-Doc goggles, a health analyzer, a defibrillator, and a hypospray. The auto menders contain healing chemicals, which we'll learn about later on. The Pro-Doc goggles let you diagnose a patient from a distance by examining them. The health analyzer displays an extensive list of ailments when directly applied to the patient. Finally, the hypospray acts as an instant injection syringe. There are 4 main damage types in the health system: brute, burn, toxin, and oxygen. Other ailments such as general sickness, radiation poisoning, brain damage, organ failure, and mutations also play a role in a patient's overall health, which can range from healthy, to hurt, to critical, and finally dead. Next we'll talk about the medicine used to cure conditions. Bruises and cuts are remedied by applying styptic powder, a pink-colored chemical. The pink auto mender contains styptic powder and can be applied to an injured patient to patch them up. Burns are soothed by applying silver sulfadazine, yellow in color, and similarly is what the yellow auto mender contains. If someone is actively on fire, you'll need to extinguish them with a fire extinguisher or pat the fire out before applying band-aids, or the band-aids will burn off. Both styptic powder and silver sulfadiazine are applied topically and if instead ingested, can cause toxin damage. Regarding toxin damage, charcoal, colored black, and sometimes green, is used to treat the raw damage and is normally applied via hypospray. It's good practice to scan a toxified patient with your health analyzer to see if any poisons are in the bloodstream. Calomel, colored green, will flush poison and everything else out of a person's system at the cost of making the patient toxified. Radiation sickness is also related to toxin damage and can be cured with potassium iodide, while the mutations gained from radiation can be removed with mutadone. For oxygen damage, the chemical salbutamol, colored blue, can be administered. Oxygen damage is sometimes related to overall critical health and is best combined with epinephrine, a heart stabilizer, and mannitol, a chemical that cures brain damage. If someone's heart stops, you should charge your defibrillator, apply it to the patient, and administer critical medicine afterwards. Throwing critical patients into the cryotubes is also a good alternative when you need to stabilize someone. To set up cryo, wrench the canister in place, turn on the cooler, and place the cryoxygen beaker into the cryotube. Finally, when a viable patient comes in, turn the tube on and monitor the patient's health. When patients die or come in dead, but not rotting, their corpse can be taken to the cloner, while rotting corpses can be sent to robotics. You'll put the corpse in the cloning scanner, access the cloning console, find their name, and hit clone. After a while a clone with their mind will pop out of the cloning pod. Placing the old corpse in the enzymatic reclaimer fuels the cloner and quickly strips the corpses of their belongings. Last in this tutorial is surgery. The main surgical tools are the scalpel, surgical scissors, circular saw, hemostat, and suture. The first 3 are for cutting into someone. The hemostat is used to stem the blood flow and can sometimes automatically do this if held in the offhand, and the suture is used to close the patient up. Sometimes you may mess up an incision. If you do, simply reapply until it's successful. Make sure to apply medicine during the surgery to reduce the chance of the patient slipping into a critical condition. Anesthetics like morphine and sleeping gas also reduce the chance at failure. To start surgery, you'll target the chest with the help intent and apply the scalpel. Next, use the hemostat to stem the blood flow and follow it up with the surgical scissors. Now the chest will be ready to operate and you can choose which region to start. In the ribs are the heart and lungs. The kidneys are in the flanks. The liver, spleen, and pancreas are in the subcostal area. Finally, the stomach, intestines, and appendix are in the abdomen. Going further prompts you to cut, saw, and snip the organ out. After that you can select the region again, but this time the organ will be removable. To insert an organ, just apply the organ to the opened section. After the surgery, make sure to suture the body closed.